Hi, I'm Georgina, one of the skin specialists here for the Amica Academy. So we're going to go through the dermaplaning PowerPoint, which is on your portal. Behind me we've got it running, however obviously you'll be able to go through that as well. So the dermaplaning treatments, let's look into the skin structure. A little bit of the anatomy. So we all know the skin is the largest organ of the body. Cells have an average lifespan of 19 to 34 days. The average person is covered by 2.5 square yards of skin that weighs around 9 pounds. The average human grows around 1,000 completely new outer skin cells during a lifetime. Red blood cells wear out at a rate of 3 million every second, requiring the body to make over 200 billion new ones every day. The body's entire supply of red blood cells is completely renewed every 4 months. It's really important to educate your clients that the skin is the biggest organ of the body. What we do within obviously does affect the skin, however topical treatments like dermaplaning are really beneficial for that product absorption, which dermaplaning really helps with. So the next slide, let's look into the skin. The skin has 2 major tissue layers, one being the epidermis, a very thin layer of non-vascular tissues, and the dermis, the dense layer of vascular connective tissue. The subcutaneous layer below the dermis is a much thicker layer composed of fatty connective tissues that varies in thickness with each person. So with treatments for the dermaplaning, ideally, we are working on the epidermis. However, it does allow products to then penetrate deeper, which can then actually reach the dermis as well. So with the skin, a unique characteristics of the epidermis is the ability to regenerate tissue continuously. The process of shedding and renewing of the epidermal tissues is called desquamation. The outer layer of healthy skin is moist and approximately 10% of water. So when you're doing and looking at your skin, we can really see signs of dehydration and whether the healthy skin is keeping that 10% of the water. So let's look into the epidermis. The first layer of the epidermis is your stratum corneum layer, also known as the horny layer. The outer layer of the skin, this is the thickest of the epidermal layers and is exposed to the outer element. So we've got your free radicals, your pollution, everything like that, that as soon as we walk outside, the first layer of the epidermis is exposed to. The cells within this layer are dry and flat. The layer may have between 18 and 23 layers of flat, dry cells that are cemented together by the lipids, peptides, sebum, and ceramicides. So with that, we can really look at your client's actual skin type. If they're a little bit more dry, if they're a bit more oily skin types do tend to have it's almost like a little bit of glue that can be holding those dry skin cells together. The dermaplaning treatment is really beneficial to actually removing those skin cells that are stuck together, giving them a much more advanced exfoliation on the skin. The next layer, which is the stratum granulosum, in this layer the lipids separate the keratin, a non-living substance and cells lose a considerable amount of the fat and moisture. These cells approximately are made up of 80% keratin and less than 20% of water. So kind of working down into the skin, we do kind of have less of the water production within the skin, which is why using like a hyaluronic acid is really beneficial whilst we're doing these treatments as well. The next layer of the epidermis, which is the stratum spinosum, is this layer is several layers thick and flattens out as it rises upwards through each layer. It's called the spiny or prickle cell layer due to its spiky appearance of the cells. So as we're working deeper into the epidermis, we've got different kind of cell types and structures as well. The next layer, we are then looking into the stratum germinativum of the skin. The basal layer, also known as, is the only living layer of the epidermis where the mitosis takes place, and that mitosis is the process of which the body cells divide from two identical cells. The layer of skin does not have any blood vessels in it either. Melanin is also in this layer. So when we're looking at certain skin types, conditions, concerns, when we're looking into this skin layer where your melanocytes are, and where the melanin is within that layer, we can then actually visually see on the surface what condition and what type of pigmentation clients can have. 90% of clients do have kind of pigmentation within the skin. You can then really help to by removing the top layer of the dead skin cells and that vellus hair with the dermaplaning. Products that you can select can help to really treat the pigmentation as well, because we're going to get a much deeper penetration. Obviously then a little bit deeper into the skin, when we're looking into the dermis, this layer of skin is directly below the epidermis, so a little bit deeper, which is the reticular layer. This layer contains the following: we have collagen, the erector papillae muscles, fat cells, sweat glands, hair follicles, nerves, lymph vessels, oil glands, elastin, and blood vessels. When we're working with the skin, we really actually want to start stimulating the dermis to create the new collagen, elastin, as well, for a much more anti-aging effect. Whilst we're working within, like we can see on this side, we've got the epidermis, going into a bit more of the hairs as well, where they lie, the follicles. Obviously we are just treating the hair on the surface. The hair on the face tends to be more of that fine downy, quite vellus hair as well, which we are removing. Skin analysis. This stage is really, really important to be able to do a really thorough skin analysis with your clients. First thing to look at would be the skin type. So skin type is our skin, is how our skin is due to the different genetics and hormonal makeup of our bodies. This cannot be changed by external treatments, but can change over time. Initially, for example, an oily skin may become lipid dry due to the reduction in the oil production caused by, for example, menopause. Throughout our lives, we go through a hormone change that can really affect how much oil production, or vice versa with the skin drying out particularly. So during your skin analysis, it's really important to actually understand where your client is at as well. With the skin type as well, it can only have its appearance improved, made more manageable in the skin type. This will then still, the skin type remains the same, however, you can really improve the skin itself and the overall appearance. Products will only have an effect on the skin type for as long as your client maintains a good routine. So their monthly appointments, what they're doing at home in between as well. Their skincare is their everyday skin treatment. So again, it's being able to educate your clients on what they're using, how they're using it, and recommending for their skin type. Different skin types. We have got oily skin. I personally do have oily skin, so obviously with that, due to the oiliness as well, which can actually promote more of the sebum on the skin, which can affect the translipid water loss as well. The skin will have a kind of more of the sebaceous phlegmons, which are like pockets mainly composed of the solidified sebum inside the tiny hair follicles of the face, so they can be a little bit more bumpy, a bit more texturized on the skin. A greasy sheen can be seen on the skin also. Throughout the day, clients might say, you know, you've got a bit more of an oilier skin type in the T-zone, and then, you know, or the cheeks are quite over productive with oil as well. Obviously on the skin surface, we can visually see enlarged or thickening pores and an uneven skin texture. The skin will have some slip to it as well, especially on the T-zone. So typically in an oily skin, enlarged pores, the spacious the phlegmons, and a greasy sheen. So we can identify what skin type our client has just by looking at it and seeing if there's enlarged pores and the greasy kind of sheen and texture it can feel like. A little bit more of the oily skin, whereabouts as well they are with their skin journey, doing their skin analysis. Where are they? So have we got more of a teen skin, which can definitely show a little bit more of an oilier skin type? Are we going into a different hormone cycle as well, which is really important to identify with your clients? So for example, puberty can result in an increase in the oiliness, and this in turn increases the sebaceous activity as well. It may result in enlarged pores as the sebum fills up the follicles as well. So being able to identify that with your client's skin, we'll be able to really cherry pick and personalise their treatment for the products that you would use within their session. During the menstrual cycle as well, the progesterone rises, and so does the DHT levels. So we can really, you know, customise their treatment on their cycle. So it might be coming up to their menstrual cycle as well. That couple of weeks before, they could get a little bit more oily. Get them in for that treatment then, to then prevent the excess oil production. Obviously as well, all of that combined can be reasons behind why the skin can become a lot more oily and spot prone in certain times, and kind of then being able to customise and slot in when would be the best time for those to have the treatments. Lipid dry skin. So this skin on the complete flip side is a underproduction of the sebum, and therefore it lacks the lipids within the skin. So it's like a transdermal lipid water loss within the skin. This can appear as dry skin easily becomes dehydrated. The natural moisturising factor in the skin can really evaporate easily without the protective barrier within the lipids. Lower levels of sebum combined with dehydration leads cells not functioning properly. So that cell turnover really actually slows down as well, resulting in premature aging if not treated. Clients complain of like flakiness, that can appear within patches of the skin, so not like everywhere. They might just get a little bit of patches on the forehead, on their cheeks, sometimes the chin as well. So again, it can actually appear more of that T-zone, but more of that lipid dry response. And kind of when they're putting the products on as well, like they sometimes feel like nothing's really when they've got more of that lipid dry skin, clients can also feel like any products they're putting on is really just seeping into the skin because they've got that lipid water loss within the skin. It can also appear a lot more supple, and their skin might feel quite tight. So when you're doing your skin analysis, whether you've got an oily skin, more of a lipid dry skin, you can then personalise their treatment for the products that you would then select to benefit their skin type. So lipid dry skin, again, it can look a lot more scaly, a lot more flaky, can become a little bit more irritated as well. So that hydration factor is an absolute must. It looks a lot more thicker. It might have a little bit of milia as well because the skin's trying to like speed up the process as much as it can, and that keratin just really gets crystallized within that process, and then you can see it on the surface. Clients might suffer from eczema or psoriasis elsewhere on the body. Again, doing that skin analysis with your clients, we want to be able to identify, is there anything else underlying, which is why we are getting this transwater, like within the epidermis, the water loss as well. Fine lines and deeper lines are more prominent on those skin types as well. So adding in that hydration can really smooth and plump, give a much more youthful appearance to the skin. There might be some evidence of sun damage as well, with sunspots, broken capillaries visible through the whole skin. So again, identifying if there's little vascular blemishes on the surface, if we've got a little bit more pigmentation or the age spots, you can really personalise their treatment. It feels quite rough to touch as well with the lipid dry skin. So having that exfoliation process is really beneficial for them. You get the sebaceous kind of filaments that are minimal as well. So within the skin and doing the dermaplaning treatment, you can give an overall smooth, balanced, hydrated, and the advanced exfoliation on the skin as well, which clients really do appreciate. Then we step into a bit more of a sensitive skin. So skin that is sensitive, it's categorised and treated as, so regardless of whether it is oily, lipid dry, or a bit of a combination, this is because products normally used to treat other skin types can cause a little bit of irritation to a sensitive skin. So really being mindful and selective of what you are putting onto your client's skin, especially after and during a dermaplane treatment. because with the dermaplane treatment, we are then going to get a much quicker penetration of the products within the epidermis as well. Sensitive skin does have a reduced barrier function, making the skin a lot more vulnerable, easily irritated, and easily dried and dehydrated. Sensitivity means that it has an overactive immune response to ingredients. So again, being really mindful and selective of, for example, using a really high concentrated vitamin C, it might actually irritate your skin if you've got a client with sensitive skin. So using maybe a bit more of a hyaluronic acid based serum would be really beneficial and have that less chance of having the response and that sensitivity to the skin. But with certain ingredients as well, causing the skin to attack the healthy cells, breaking down the collagen, elastin, hyaluronic acid naturally found in the skin, making the skin become like further dehydrated. So we could actually cause more sensitivity by not using the correct ingredients within the skin as well. The appearance of the sensitive skin, so the results in like premature aging if left untreated. Sensitive skin also reacts as an extravagant kind of manner to friction and pressure within the skin, causing the skin to really flush quite easily. So as soon as we're doing that cleanse on our skin, on your client's skin, we can actually start to see if they're quite sensitive and how much of that lipid barrier within the skin has become impaired. If you're using like a nice gentle cream cleanser with just quite gentle movements whilst we're cleansing, we've already got quite a flush. This can really indicate to your to you doing their treatment that they've got quite a sensitive skin. So again, just be mindful and be analysing your client's skin whilst you are doing the treatment, step by step. Sensitive skin can also show kind of broken capillaries as well, typically found across the nose, cheeks, forehead, almost like a little butterfly pattern as well. Skin can look quite purple in places because of the vascularity within the skin and that kind of pressure for the skin, always trying to give it that blood flow to settle. However, it appears then on the surface as the broken capillaries. The skin may produce an erythema, so the redness and kind of unaffected areas at the lightest touch as well. So again, when you are working with your client's skin, when you're doing that cleanse, if you've got that instant flush, it's a big indication that they do actually have quite a sensitive skin. So you want to be mindful then moving forward onto the next step. You might see actual lumps that look quite sore. In severe cases, this can include swollen and a red nose. That does then indicate we've got quite a rosacea patient there as well. So you want to be mindful and selective of which treatments you can then perform on their skin. A lot of calming agents as well to think about whilst you're doing their treatment. It can actually feel quite hot to touch because they've got that constant flush as well. So be mindful of not having your water too hot, things like that to really include in your treatment plan for that client's skin. Bit of a combination skin, so we can see all of the, sometimes oiliness, sensitivity, and the lipid water loss within the skin as well. So the combination skin has a slightly oily T-zone, which contributes to the silkiness of the rest of the skin as well. Oils are needed to keep the skin then supple. The term combination is used when you're actually explaining that to clients as well. they may need to treat the T-zone differently to the rest of the skin. So if you've got a combination client for their skin type, then you can explain to them that you are going to personalise their treatment and select their products. For example, we've got a bit more of a dehydration on the skin. We can see that lipid barrier is impaired, so we are going to make sure we are applying a lot more hyaluronic acid to those areas. We've got a little bit more oily and congested areas, so for example with the mask we're going to be using a little bit more of a clarifying, purifying mask to help draw out the excess oil and really personalise their treatment again. So you can treat the T-zone differently to the rest of the skin, and that occasionally the breakouts as well, you can start to reduce those. If they've got, during that menstrual cycle as well, they might be a bit more prone to those breakouts, so really selecting as and when you do the treatment as well can really help maintain the skin at a much more balanced level, giving them a longer lasting result from the treatments that you can deliver as well. Combination skin leans slightly over to a bit more of an oilier skin type, rather than having more of a lipid drive on. You might see a little bit of the dryness, but not necessarily flakiness, and it's more in that T-zone area, so you can then really work with that client and personalise their skin treatment. So with the combination skin, obviously we've got the oily skin types as well as an over production of the oils. Drier skin type is an under production of the oils. Combination skin quickly becomes dehydrated with these products as well. So again, you really want to select which products and treatments that you can perform on your clients. For an oily skin, products can actually sometimes strip away the protective barrier of lipids, leading to a natural moisturising factor in the skin. So if we are using, you've got a client who has quite an oilier or combination skin type, they're using a salicylic glycolic cleanser every single day, you can actually see a stripping of the skin. Their skin would actually become a lot more oilier, whether or not be it in the T-zone area. If you've got a combination skin, more of an oilier skin, it's just going to start producing and producing a lot more of the oil as well. So actually you can educate your clients on how to use their products properly at home. As we said, that is your everyday skin treatment, but then let's recommend a bit more of a gentle cleanser. They can use that every day, and then you can use their treatment cleanser, so your salicylic, your glycolic cleansers, a couple of times a week, so they're still treating their combination skin type as well. When you're actually treating your combination skin, you should consider it in separate parts as well. So again, you might want a bit more of the hydration on the cheeks, and then kind of a bit more of the clarifying, purifying treatments within that T-zone as well. A typical combination product usually focuses just on the oily parts, on that T-zone. It's therefore kind of usually sebum reducing and lacking in hydrating ingredients to balance the skin out as well. When you're looking at your client's skin, it's really important to identify the Fitzpatrick skin type also. So when we're looking at the Fitzpatrick scale, we are looking from a scale of 1 all the way to a 1, all the way to a 6. This will also identify where kind of, do they sunburn quite easily, do they tan quite naturally and be able to withhold that tan. We'll then be able to see a little bit more of the production of the melanocytes, which is where your pigmentation which then can be seen on the surface, we'll be able to identify a lot more how their skin can respond, what we can then see on the surface before and then post treatment as well. So being able to identify that Fitzpatrick scale for their skin, again, you can then personalise their treatment to what their skin will really benefit from as well. Fitzpatrick skin type 1. So the skin colour kind of before sun exposure is really quite pale, more of that ivory skin type as well. That eye colour is a lot lighter, so like a light blue, light grey or a light green. We've got natural hair colour, red or a light blonde is most typically seen with a skin type 1. Their sun exposure reaction, skin always kind of freckles, always burns and peels and never really tans as well. Then we've got the skin type 2, which we then go on to kind of the skin colour before any sun exposure, which is a lot more pale and fair skins. Eye colour, we've got a bit more on the blue, grey and then green, which is a bit more of a deeper colour compared to the skin type 1. Some reactions to the UV exposure, we've got the skin kind of usually freckles, it can burn and peels often and rarely tans, so you might get a little bit of tanning, however they do tend to burn quite easily still. Skin type 3, we've got the fair to beige, a bit more of an olive skin type as well, with golden undertones. Eye colour tends to be a bit more of a hazel or light brown. Natural hair colouring, we've got dark blonde to a lighter brown. And then skin reactions with UV exposure, skin might freckle, burns on occasion, and sometimes tans. So with that as well, always consider how much their skin tans and can burn. Skin type 4, you tend to have a bit more of an olive, a deeper olive and a light brown skin type. You've got the eye colour more of a darker deep brown. Natural hair colour tends to be a dark brown, and sun reaction with the UV exposure doesn't really freckle, rarely burns and always tans, quite often holding that tan quite well. Skin type 5, we have the skin colour more of a darker brown, eye colour tends to always be dark brown or even a black. Natural hair colour, dark brown and black. Sun reaction to the UV exposure, rarely freckles, almost never burns and always tans as well. This skin type will really maintain and hold that melanin production from the sun exposure. Skin type 6, deeply pigmented dark brown or more of a darker skin type as well. Eye colour tends to be a brownish black. Natural hair colour tends to always be a black. Sun reaction to the UV exposure as well. Never freckles, never burns and always tans quite quickly and darker as well. That skin type does tend to, once they've come back off holiday, with the skin type 6, they can really hold that melanin production for a good month as well, post holiday or UV exposure. Hair growth as well, because obviously we are treating quite a vellus hair with dermaplaning, so let's go into a little bit of that. Hair growth, obviously we've got different hair growth patterns and different hair types all over the body from head to toe. So the hair grows through the narrow tube-like depressions within the skin called the hair follicles. The root of the hair is surrounded by the dermal papilla, which has an abundant supply of the blood vessels which provide the nutrients to the area. New hair is then formulated in the papilla and created by the hair germ cells. Hairs are often quite soft at the base and eventually harden as it grows and die as they get towards the surface as well. So the only living part of the hair is where it's fully attached within the follicle root. As it then grows, hits through the epidermis onto the surface of what we can feel and then see, that is actually then the dead hair. So when we're looking into the anatomy of the actual hair follicle, we've got the hair shaft, which is the hair itself. These follicles are within the dermis layer as well, growing through up to the epidermis. We've got the erector pili muscle, which is where you've got your blood supply also to that hair. You've got your sebaceous gland. If someone's got quite an oily skin as well, they'll have a little bit more of the oil production within that sebaceous gland. You've got the hair follicle, the hair bulb, and the hair papillae. So within that hair growth cycle as well, we can then identify what type of hair we are working over. Tend to work just over the fine vellus hair, which is known as the down fining hair, over the surface of the skin. You might find a client with a slightly thicker hair, sometimes on the lip. Different hair growths, we have different cycles. One of them known as the anagen stage, which is where the hair is active. And within that cycle, that's the first hair growth cycle. This is the most active growing stage that can last for a good kind of couple of weeks to a few years of that hair growth cycle. This stage ends when the hair becomes detached from the dermal papillae. The following stage then is the catagen stage, which is the hair's transition from the active to the resting stage. The hair has at that stage stopped growing and the follicle begins to shrink, so that new hair cycle can start all over again. This brings the cycle then to the telogen stage, and this is the resting stage of the hair growth. The hair is now ready to then shed and then start that whole cycle again. So we go from the anagen stage, which is the very first stage, catagen, and then the telogen stage of the hair growth. And then here on that side, we've then got that process there. So your anagen tends to be an active, A for active, so anagen. Then we've got kind of the catagen stage, which is the transition phase. And then we've got the telogen stage, which is the resting phase as well, which can last up to a good 5 to 6 weeks. And then we're going back again on that cycle to the first stage, which is the anagen stage. So what is the dermaplaning treatments? Dermaplaning is a really advanced skin treatment for the exfoliation and using the scalpel to remove the excess dead skin, also the fine downy or sometimes coarse hair on the areas of treatment. This has the benefits of allowing a better product penetration and makeup application as well. Clients can have this done before an event, before they have their makeup done, and it just gives the skin such a clear, really smooth surface to have that application of the makeup done absolutely flawless. The products that you use instantly within the treatment and then what they're then using at home have a much deeper penetration and getting much more value out of their products that they can use as well. As we're doing the treatment, because we are going to stimulate that cell turnover in the process, we can actually stimulate the collagen and elastin also. You can also define hairline, so when you're working with the clients, a little bit more of that skin type Fitzpatrick of a 3 up to a 6, and sometimes a lot fairer as well. When you're working kind of around the hairline, you can really give them a defined appearance to that type of hair as well. You can work around the brows, obviously sideburns, giving your clients a much more overall face shape and contour. So dermaplaning treatment, you can do this as a standalone treatment. You can use a gentle skin peel with the treatment. You can combine it with hydrofacials and certain other treatments that you can offer in clinic as well. You can use this as a prep treatment before microneedling skin peels, as we've discussed a little bit with hydrofacial as well. It's a really, really advanced microdermabrasion compared to the other kind of ablative electrical treatments that you could have as well. So it's quite safe and effective to work on that more sensitive skin type as well. The treatment is similar to that of a kind of a male wet shave. The scalpel is used to gently scrape the surface of the epidermis and lift away any of that unwanted dead skin cells, oils and hair. So when we spoke about the oil and combination skin, the oil does actually act as like a glue to the dead skin cells, so they are then actually on the surface of the skin for a lot longer when you're doing the dermaplaning treatments. Because we are removing that, it's really good and a balancing way to treat that oilier and more combination skin type as well. Skin is left absolutely glowing, soft and smooth for at least up to 2 to 4 weeks as well. Dermaplaning versus shaving. So obviously there's a lot of different disposable handheld devices that clients sometimes come in with, and it's like, oh yeah, I just use the disposable one from Boots. The difference between a professional dermaplaning treatment and a shaving treatment that they can do at home, you can't compare the two really. Professional dermaplaning treatment is developed primarily to remove the outer layers of the skin. So really deep and advanced exfoliation treatment is achieved. They can't then achieve this at home with the shaver. The other main benefits of this is also the removal of the peach fuzz on the face, along with the ability to shape the sideburns, giving that a bit more of a contour. You can tidy the brows and the hairline. Shaving is defined as cutting the hair off one's face with a razor. Dermaplaning uses a scalpel, so it's a lot more sharp. We're getting a lot more closer to the skin as well. So being able to kind of explain that to your client of how much more advanced of a treatment it is. Using the scalpel also kind of cuts the hair as well, but a lot closer to the surface of the skin, but we are removing the dead skin cells with that as well. Both the blade and a razor are placed at a 45-degree angle over the skin to achieve optimum and safe results as well. A razor, however, is less likely to blunt or snag on coarse kind of terminal hair, which can catch the skin. This is why it's not a suitable treatment to perform over males. So for example, if you've got a male client in, they want a dermaplane, you wouldn't then go into that terminal hair and start kind of removing that as well, because it would be quite damaging for the skin and the hair. Overall, we just really want to treat the fine, downy, soft, kind of fluffy hair that we can see on the surface. A little bit more into dermaplaning versus shaving. Shaving can be more aggressive as well, due to there not being any kind of dermaplaning is a little bit more of an aggressive treatment, because there isn't a shield over the blade. However, when you're doing it as a professional, those angles, the techniques, it's a very safe and effective treatment to do. Dermaplaning uses a surgical and disposable single-use blade as well, so it's a lot more clinical, a lot more cleaner and safer to do over the skin. Dermaplaning is performed using a single blade, whereas shaving, some people can use that 2 to 6 times, and also have the stacked blades as well. Dermaplaning cannot be used over excessive terminal hair such as beards. So if you've got a client with a excessive hair growth cycle as well, we want to be careful around those areas. Or if you're treating a male client, we don't want to be going into that terminal hair. Shaving can be done daily, where dermaplaning ideally you don't want to be doing that any sooner than 21 to 28 days apart. So ideally that client can be coming back in 4 weeks time after that first appointment with the dermaplaning. So the elements of the dead skin and vellus hair. So we want to kind of have no downtime. We've got makeup application is flawless post-treatment, lessens acne breakouts, perfect for those with sensitive skin or with suffer from rosacea as well. Improvements of the skin texture, promote cellular renewal, because we're increasing that cell turnover, as we've said, with the collagen and elastin production, so really good for anti-aging. Increases product absorption as well, so everything that you use in clinic is going to get a much deeper penetration into the skin, and then vice versa, the products that you recommend for their home care are going to get into the skin a lot more deeper as well. Okay, so we've got the dermaplaning health and safety. You should always check with your local council in case you do require a license to be carried out for the treatments. Ensure the treatment area in which you are working with is well lit, so a lot of natural light if you can, or fortunately now we all use a ring light as well, so it's really important to make sure you've got a lot of lighting for a safe and effective treatment. Only use clean, sterilised blades and handles. Ensure you have adequate hand washing facilities, wear the correct PPE, ensure you take before and after pictures of your client's skin, conduct a proper consultation prior to treatment and skin analysis, have a sharps box to hand, book in for a hepatitis B vaccine as well, which is helpful, have a clinical waste contact in place if required by your local council. So always just double check with your local council to make sure you are meeting their requirements for you to be able to perform the safe and effective treatments. Safe use of blades. Blades are a single use per client, so you should never ever use the same blade. Disposal of the blade straight after the treatment in the correct sharps box. Always wear your gloves when you are doing the treatment. Hold the blade at a flat angle to the skin, normally around 45 degrees. Keep the blade in contact with the skin during the treatment unless moved to a new area. Keep the skin taut at all times. So when you're doing that treatment as well, sometimes it's really beneficial to actually place your client's head to the side and then pull as well. This will give a really good taut skin. The more taut the skin is, the more comfortable it's going to be, and the less chance of you actually nicking the client. Safe use of the blades. Be aware of facial contours as well, so you want to be working with the skin, especially around the nose, and obviously as well, you don't want to nip the skin. Do not work over the area as well, so once you've kind of done that area, that is it. You don't want to be going over. Don't work over active acne or spots, because we don't want to be spreading that bacteria. Avoid moles and any raised blemishes. Be aware of the blade and where your hands are whilst you are doing the treatment, the positioning. Make sure you're comfortable. The more comfortable you are as well, the much more of an easier glide that you're going to get with that blade. Should you get a blade injury from the treatment, ensure you follow the correct procedure, as that's the same as a needle stick injury as well. Waste disposable of the sharps. Blades must always be disposed of in the correct manner, so using the correct sharps box for your blades as well. Under no circumstances blades should be thrown away in the general rubbish, kind of household waste. Never ever, always just in the sharps box. Use the appropriate blade remover to remove the blade safely from the scalpel handle, and then dispose of this in the correct sharps box when full. Any contaminated waste should be disposed in the clinical waste bag and disposed of with a specialist waste company. So obviously double checking with your local council, making sure you've got the correct sharps bin, and then making sure that you already have that contact in place with the specialist waste company. A sharps waste contract should be in place of just to dispose of those sharps correctly as well. So double checking, is it up for renewal? Everything like that should already be in place before you go ahead with these treatments. Sterilisation. Both handles should be sterilised between clients to prevent any cross-contamination. So leaving in overnight in the barber side. The autoclave as well, which is really good. Ultrasonic cleansing, wiping over with a sterile wipe, and washing the handles in a hot soapy water. So ideally you want to be washing them first, then wiping over with a sterile wipe, then leaving overnight in the barber side. If you've got an autoclave as well, that's really good. And then the ultrasonic cleansing, you are going to cover all basis of the sterilisation of your tools, and then you're going to prevent any cross infections as well. Contraindications to treatment. Active acne is an absolute no for treatment. You definitely want to avoid that area as well, because this will spread the bacteria over the skin and cause further breakouts or worsen the infection. People prone to keloid scarring, especially those of a much higher skin type, so you're looking more of the African Caribbean skin type, so Fitzpatrick 6, who are more likely to scar. The treatment may kind of, if you do nick and it scars, that healing process could actually bring on a keloid scar. We don't want that for anyone. Men over kind of facial hair as well, we really don't want to be removing and doing a beard removal with a dermaplaning treatment. You can definitely recommend those to the barber for a hot towel shave. Male facial hair is it's way too thick and dense, it's more terminal hair. The scalpel and blade will blunt very quickly and cause you to nick the client, so again we just don't want to risk any of any indications to the treatment. Recent sunbed or active sunburn and that sun exposure, skin might look quite fine. Subclinical wounds may be present below the surface. Treatment over already injured skin also might cause a hypertrophic kind of scarring or pigmentation. So you could actually cause like a PIH, post-inflammatory hyperpigmentation or hypopigmentation. And again, obviously we don't want to have any of that for your clients. So doing your consultation and a thorough skin analysis is really important to highlight any of those contraindications to the treatment. Any allergies to the metal, especially nickel, stainless steel blades are used as well. So if we've got an allergy to those, unfortunately we wouldn't be able to do the treatment. However, it's always worth caution when working with your client with any known allergies as well. So double checking and just clarifying for their allergies. Clients might be using antibiotics, steroid creams, retinols, or like an Accutane, Roaccutane, any treatments like that, medications. Any medication that can affect the skin thickness, compromise the sebum production or wound healing, kind of for that treating secondary conditions such as acne or psoriasis that could lead to further inflammation. So in an ideal world, we don't want clients to be on any medication for kind of and double checking that to make sure that we're not going to further and worsen that inflammatory response to the skin. So you might be able to kind of recommend a different skin treatment where we're not going to be using a blade over the surface. Frequency of treatments. Treatments can be done every 3 weeks or 30 days to coincide with the skin's natural cell turnover cycle. Ideally, I kind of get my clients in once a month or once every other month if we're then including it with a different treatment. Dermaplaning lifts away kind of 2 to 4 weeks of those dead skin cells as well. So doing that any sooner than 3 weeks can cause the skin to actually overactive and kind of get a bit more oily and compensate what we have actually removed. Definitely would, if you are to do it within that 2 to 3 weeks, you can actually see a client having a bit more of the peeling and dryness post-treatment if they've had the dermaplaning alone. If this is the case, you need to increase your time in between treatments to coincide with their skin cycle and their cell turnover. If you've got quite a youthful skin that you're treating, their skin turnover is going to be quite quick, quite active, really youthful. You might, we can do those once a month. A little bit of more of an aging skin, we've got that cell turnover a little bit slower, so you might want to go a little bit longer in between their treatments, every 5 or 6 weeks. Huge question that's always asked: will hair grow back thicker? The big answer is no, because the hair is pre-programmed, and by shaving it will not cause the program to change. Coarser facial hair that is a bit more terminal, that is found kind of on the brows, upper lip, the chin, has a different hair growth cycle as well. It's a lot more thicker. It's a lot more related with the terminal hair. So, if someone's a little bit more hormonal imbalanced, we can see that on the chin as well. So it's not going to particularly stimulate that, but that will then grow back a lot quicker from when they've had their dermaplaning treatments, because it's a different hair type. Superficial, vellus, fine downy hair, usually found on the cheeks, forehead, nose, sideburns, that can take at least 2 to 4 weeks to reappear. So even if your client's got that terminal hair, you just going over the chin a little bit, you still wouldn't get them back in for that 2-week session. You'd still wait a month for their next treatment. Many people find over time and continued treatment, this does slow down with the hair growth. Combine your treatments with a hair reduction serum to assist in shortened hair follicle, this putting it into a more dominant state, which can really kind of hold back on that hair production as well, which is really helpful. So can your client have this treatment when pregnant or breastfeeding? Yes, your client can. So as long as that they don't have any active acne, then you can treat most clients as well. Because this treatment is only a gentle shaving of the epidermis, we are not stimulating any deeper layers of the dermis as we would with like a microdermabrasion, whilst the results between microdermabrasion and dermaplaning are the same because we've got that advanced exfoliation on the skin. The treatment is much less evasive as well. It will not kind of stimulate any of the hormones as well, or pigmentation, when we are combining with safe aftercare products and aftercare recommendations for your client as well. I could not combine dermaplaning with any other treatment as it's insisted after. It's just a standalone treatment. If your client is pregnant or breastfeeding, you would just do dermaplaning treatment on its own and not combine any further treatments within that scale as well. Treatment timings typically take at least kind of 20 to 30 minutes just for the dermaplaning to complete like the whole overall time. Personally, I do allow at least 45 minutes for a dermaplaning treatment, but usually on average kind of the treatment takes between 20 and 30 minutes to complete. This will include the cleansing, the treatment itself, application of serums and a mask. This treatment can be extended by incorporating other treatments into it, or simply including face, neck and shoulder massage. But also you want to utilise that time to make sure you have got a really detailed skin analysis. Even if they are a new or returning client, you still want to be doing that skin analysis every single time you see your client. Your client's skin can change month to month, week by week, so allowing yourself that time is really beneficial. How much can you charge? Whilst dermaplaning is not a new treatment, it's still kind of within that treatment, depending on your area as well. Your time, you might want to do it in 30 minutes, you might want to do it in 45 minutes. If you are including other treatments as well, really important to include the dermaplaning price, because time is money as well. So dermaplaning alone, you are typically looking to charge between 35 to 65 per treatment for a 30-minute session. The variance price are because of the kind of your local area, so always do a little bit of research, which can really help. So the risks and the side effects of the treatment: dermaplaning blading can create the scraping, nicking and or abrading of the skin, so we do need to be quite gentle but also firm enough to make sure we are removing the dead skin cells and the vellus fluffy hair from the surface of the skin as well. Many patients are often concerned that the hair will grow back thicker and heavier, sometimes darker after dermaplaning. This is obviously not the case. and hair will grow back at the same rate and texture as before, as long as those treatments are done within 4 to 6 weeks. Patients who have an oilier skin, inflamed skin, acne, or are allergic to nickel are not ideal candidates for the treatment. Now, I've personally got quite a oily skin. I know that when I do have a dermaplane, I will have a couple of days of excess sebum production, because obviously we are actually stimulating that and removing that kind of glue-like structure within the dead skin cells. So I always know kind of post-procedure, so again, you just have to be really patient selective, but also more importantly, if they have inflamed acne, allergic to nickel, they are not ideal candidates for the treatment. Dermaplaning can be done as often as 3 weeks, however, ideally just on a monthly basis, every 4 weeks for the clients, just to make sure as well. And then usually when it's done, the vellus hair starts to then grow back after at least 2 to 3 weeks, so they're ready then for that 4th week monthly appointment. Some patients may experience dryness or irritation, post treatment acne flares, or folliculitis. So if they do have those side effects to the treatment, there's always some risk with any treatments that we do perform. For example, like I've already said, a little bit of excess oiliness post-treatment if they've already got an oilier skin type, and then any redness, because we are kind of disturbing that top layer of the skin. However, we can then combat the redness, irritation with the products that we can select after you've done the treatment. Obviously any acne flares, again, we are stimulating that cell turnover with the treatment itself. So anything that is underneath and is ready to come out, we're going to stimulate that process. So with that, we just want to make our clients aware of anything like that. Blemishes, cold sores may result after this treatment. If someone's quite prone to a cold sore, usually they do know about it if they can have a flare up. So again, it's just asking your client, making sure that you've covered all of those possible risks, all the side effects that can occur after the treatment as well. So before the treatment, you want to really make sure you're diving in with your clients. Have they got an event coming up? You know, what products they're using. Are they using a retinol? Have they had a recent sunbed? Have they been on holiday recently? Going into so much detail with them, we'll be able to allow them to prep for their treatment, and also be able to let them know the information that they need prior to their appointment, minimalising the risks and the side effects post-treatment as well. So 7 days before their treatment, avoid waxing before and after. Obviously waxing does remove the dead skin cells as well. We don't want to be doing a double removal of that. 3 days before the treatment, avoid topical products such as any tretinoin based products, retin A, retinols, retinoids, glycolic acid, AHAs, your any bleaching products. Some clients might bleach their top lip as well, so they do need to avoid that, because again it can cause sensitivity with the skin. Avoid waxing, bleaching, tweezering, or the use of hair removal cream on the areas. Again, this is just to make sure the skin is going to not have so much sensitivity post-treatment if they are tweezering, bleaching, threading, using any retinol products as well. So before the treatment, you cleanse the skin with a mild cleanser just to make sure, obviously, you're removing any of those impurities But whilst you are cleansing, you can really start to identify what their skin type is as well. Avoid excess sun exposure and the wear of a really good broad spectrum SPF daily, SPF 30 or higher. Personally, I do always recommend an SPF 50 for clients, just to make sure everything's covered. Some of the 30s are a mixture in like a moisturiser as well, which can actually dilute the SPF content. Inform your provided if you have any history of facial or kind of nasal herpes, to receive any advice on the antiviral therapy prior to treatment. So if they are having that treatment or are about to start taking the treatment, just having that open conversation with your client, just to make sure if they are taking any medications as well, we need to make sure it's not going to cause any risks or side effects post-treatment. So immediately after the treatment, it is very normal for the skin to appear a little bit red, so a slight little bit of erythema on the surface is what we can see, and a little inflamed. Light scabs may form on a treated area and remain anywhere from 20 to 24 hours, especially if you've had a little nick on the skin. Discontinue any use of topical products for 72 hours following the treatment. So for example, if they are using quite an advanced and high concentrate of vitamin C, just wait 24 hours. Any retinols, retin-A's, retinals as well, you need to wait at least 72 hours post-treatment before they're reapplying those products. Keep everything quite mild on the skin, from cleansers to mild lukewarm water to mild hydration as well. Nothing too strong or active on the skin post-treatment. Do not use any heavy makeup for the first day. Now obviously this treatment is amazing for clients that are then having an event and they're having the makeup done. Ideally they need to have this treatment done prior, so the day before they're then going to have their makeup done, just to make sure the skin is settled prior to then having any foundations on, because a lot of them are chemical based. Avoid excess sun exposure and wear of broad spectrum sunscreens daily, absolutely, SPF 30 or higher. Combination therapies, so dermaplaning can be done prior to any of these procedures. So if you are mix and matching, tailoring treatments, adding in dermaplaning is a really beneficial way to some more advanced skin treatments as well. You can do it kind of prior to any of the microdermabrasion treatments, light skin peels, laser skin rejuvenation or IPL skin rejuvenation, before any deep cleansing facials as well, and LED light therapy. Sometimes by adding in certain, and again client, make sure you're picking out the correct clients for this, but LED after a dermaplaning treatment works really well, just to help calm that redness down if they've got any, or using a blue light, or kind of using a more of a red light to get that collagen production really active. And when you're using skin peels, you should stick to the lactic acid only, as these are loaded with antioxidants and nutrients and are made without harsh chemicals as well. So we're going to minimize the risks and side effects. However, they're still going to get a really gentle but even more advanced exfoliation with the skin with using a lactic peel. Again, just without using any harsh chemicals that may induce a burn on the skin. So if we're using a glycolic salicylic skin peel, might actually be too much for the client's skin, so always just go with a lactic acid peel. Thank you for taking your time going through the PowerPoints for your online portal. We're really looking forward to seeing you at the Academy here.